Government wants to establish the forum after the historic signing of the Presidential Health Summit 2018 Compact, which mandated all stakeholders to work together to reform the healthcare system. The public and private health sector is vulnerable to fraud and corruption because of the large and varied numbers of transactions. Let's now go live to the Union buildings.
Blessings. The forum makes good sense in order to ensure good health as we move forward towards an integrated, unified and efficient healthcare system for all in our country. Thank you.
Thank you very much, Deputy Minister. Ladies and gentlemen, you will know that this anti-corruption forum that we are launching today was an outcome of the Presidential Health Summit that had been convened in October of last year. That particular summit had been attended by a diverse array of stakeholders who were coming together, both government, public, private sector, to say that how do we deal with the crisis in the health system and what are the signposts we need to put in the roadmap towards a quality, unified health system. So we're ticking those boxes, and I think you'll know that the President does a lot of that. Just today, the Special Investigation Unit, Special Tribunal, that the President had also announced to assist government claw back money that had been lost through corruption and malfeasance is begin operating. So I had to have that little commercial break. Before then, we invite our next speaker, and that is Mr. David Lewis, who's representing civil society. Over to you, sir.
Thank you, Program Director. Mr. President, you'll not be surprised to learn, and I hope you'll be pleased to learn, that the first promise that civil society will give to you is that we'll continue to hold government to account. But it would be churlish and it would be tactically stupid not to acknowledge that the framework within which we're working now, as exemplified by this meeting, is a very different one to the one in which we started. You know, there's no question about it. We're dealing with a government that is far more accommodating, that's far more willing to engage with the likes of us, and that's important and productive. And this is nowhere better represented in our relationship with the SIU, which I think is taking a leading role in dealing with corruption and a leading role in engaging with organizations like ourselves. And our relationship with the SIU is nowhere better exemplified than in the Health Forum, where we have been provided with a forum of all the engaged stakeholders in the sector, a forum that is not characterized by grandstanding and long speeches, but is a real business-like forum to which we can bring reports that have been given to us with the assurance that they are going to be dealt with. And that may sound like the sort of thing that obviously happens, but it doesn't always happen. And it does happen in this instance. And it's been a real privilege to work with the SIU and to work with the other members of the forum. Now, in the spirit of being offered a finger and taking a hand, which is another feature of civil society, we really want this model to be extended. The priority sectors that we're dealing with are health, policing, and I mean policing on the ground in the communities, and mining. And in mining in particular, we're dealing with the theft and the looting of mining royalties from some of the most impoverished communities in the country. And we think that this would be, our work in those areas too, would be enormously advanced. And I think, in all modesty, the interests of the country would be advanced if the model that the Healthcare Forum has now provided us were extended across these other vulnerable sectors. And as I say, in the same sort of business-like, down-to-work kind of manner that has characterized the Health Forum. So it's a privilege to be part of it. It has helped our work immensely. I would like to think it's helped those whistleblowers who have reported cases of corruption to us. And let's hope that this forum continues to grow in strength and that it acts as a model for what could be achieved in other sectors of the country. So thank you for this.
Thank you very much, Mr. Lewis. I would like to invite Ms. Unyana Ruhehe onto the podium. We've chosen not to highlight the organizations that they come from because the decision has been made that they're speaking for civil society broadly. And on that note, I invite you to make your input, ma'am. Thank you.
Thank you so much for the opportunity to say a few words. I am from Section 27. I'm the Executive Director. And I think I should say... I wanted to say that you will often hear about Section 27 and other organizations in relation to litigating against the state. And I think I should take you into my confidence today and say that we actually prefer to work with government. And in fact, it's our privilege to work with government hand in hand. DG Matsoso is here from the Department of Health, and she will testify that we work well with her office on matters of health policy, and including matters like the Life Isidimeni arbitration in which we represented the bereaved families. And I think it's important to note here that DG Matsoso said in that forum that governance and health has to be done hand in hand with civil society and with communities. And she said so under oath, I might add. I think it's important for us, the context is that these type of violations that we're talking about, the violations of the PFMA and criminal law in terms of fraud and corruption do have a real impact on people's lives. And often it means not having access to ambulances because of corruption, or not having access to surgeries, life-saving surgeries, because of corruption, fraud, and theft at facility level, but also at other levels. And that's where we work with communities to try and empower communities to understand what their rights are in relation to the health systems, so that they can hold power to account. So those are the communities that are meant to be served by the health facilities, and they themselves need to be part of the governance of those health facilities and to be able to hold public power to account. So our job is to continue to blow the whistle where we see violations of the law, and where we work with communities that are trying their best to engage with the state and often come to us about these kinds of violations. And we teach them about their rights. We teach them about Section 195 of the Constitution, which is about transparency and accountability, and what that means at the health facility level. So for us, we will continue to do that public education. In terms of the terms of reference, that's one of the aims of this forum, and we will continue to do our part in that regard. I think I will just end by saying we look forward, as Dave has said, to continue our engagement with this forum. It's an important part of our work in advancing the right of access to healthcare services. Thank you.
Thank you very much. And I do promise you I was not trying to hide Section 27. We also prefer a collaborative approach. Thank you very much, Unyana. Our next speaker is Advocate Andy Mutibi. He's the head of the Special Investigating Unit, and he'll be speaking to us on the role of the SIU in the implementation of the terms of reference of the forum.
No, thank you very much, Program Director. Honorable President, thank you. Honorable Ministers, Deputy Ministers, and colleagues. We are really delighted to see that we have reached this milestone. This Anti-Corruption Health Sector Forum has really been formed as a response to the outcome of the Presidential Health Summit. We immediately got down to work, and did the risk-based approach to corruption-vulnerable sectors. As we speak today, there has been an outcome in terms of those assessments, and some of the exposures are as follows. We have found that there's a huge exposure in the supply chain management space, procurement and purchasing process, and the irregularities that are attendant in that space. That's pretty much the biggest exposure. There has been also exposures indicated in the health professional registration and accreditation process, and in that regard, there's already a proclamation, Mr. President, that has been signed off, and we are busy at work. Dr. Bila, sitting on my right-hand side, already can attest to that at the Health Professions Council. We've also found that there's collusion in the system where various parties in the system collude, and we are already busy with the investigations in that case. The Deputy Minister indicated in the medico-legal space, Honourable President, that we have already started work in the Eastern Cape, in Gauteng. We've already received allegations from Northern Cape, in KZN. We are busy now putting together a proposal for the proclamation that will be national, so that we can attend to all the provinces. The other area is over-servicing, which the market inquiry yesterday called overutilization. I'm informed that over-servicing is the subset of the overutilization. It's a technical term. Doctors in the room would know what it means, but we are also looking at that. Overpricing is one of the other exposures that we have looked at. And what in the public sector is called RWAPs, which is the remunerative work outside of public service. We have found that there's quite a gap in terms of managing that space. As I've indicated, there's various investigations already underway in the Health Professions Council of South Africa, the provisions of aeromedical patient transport in the Northwest, provisions of aeromedical and patient transport in the Free State, National Health Laboratory Services, we're already busy there, Council for Medical Schemes, and this area, and I see that the representatives of the regulator are here, Council for Medical Schemes, we are finding already that our investigation, though it focuses on the Council for Medical Aid scheme, it gives us an indication of the irregularities that are happening in the private health sector. And as we always indicate, that we will deal with corruption, whether it emanates in the public sector or in the private sector. So those are some of the investigations that are already underway. And this forum has really, as the colleagues from the civil society has indicated, once it was formed, we already saw a number of allegations coming through. Of importance is the focus on ensuring that we conduct quality investigation and produce quality outcomes. And this is where, Honourable President, consequence management comes in. We ensure that we release the outcomes, whether it's civil litigation where we have found that there's recoveries that needs to be made. And indeed, Program Director, we are really delighted to see that today marks the official effective date of the special tribunal. And we will ensure that we support the tribunal so that it recovers the monies that have been stolen due to corruption, maladministration, and general malfeasance. Public prosecution referrals, and I know that my colleague NDPP will speak to that, and also disciplinary actions. But of importance is to say we would like to make sure that we add value. We add value, and that value add is in the form of systemic improvements. As we investigate, we come across inefficiencies in the system, which we then make recommendations on how the system can be corrected or the controls can be improved. Mr. Lewis, I really add to your point that we have conducted under the auspices of Anti-Corruption Task Team, under the auspices of the JCPS led by Honourable Minister Mapisa Ngakula. We report quite frequently there. We have done a risk assessment in this case of the vulnerable sectors. Health is one of them. We have included some of those mining SOEs, and we would like very much to use this blueprint taking into account the unique requirements of every sector, so that we apply this model in those other sectors. As I conclude, we would like to make sure that we add much value. As we go into the NHI space, there's all those vulnerabilities and assessments of risks that we need to focus on. And it is important that we play a big role in the prevention side. So the prevention side is the area, Honorable President, that we would like to make sure that this forum plays into. And in that space, there's a various methods that we would use. We would like to use data analytics so that we are able to do predictive modeling, so that we are able to detect, identify, and make sure that the controls are improved. Where appropriate, yes, refer for investigation, and appropriate outcomes should be reached. And indeed, we would like to make sure that we produce the appropriate scenarios that can be reflected back to government or to the private sector, so that they reflect the exposures in this sector. And appropriate monitoring and evaluation, and appropriate reporting, and of importance, indeed, execution and implementation. Thank you very much.
Thank you very much, Advocate. Maybe just to reiterate the point, the Anti-Corruption Forum, as you know, comprises the health sector, regulators, it's the law enforcement agencies, it's civil society, it's public and the private sector, which really is talking to the fact that we need everybody to work together in the fight against corruption in this space and generally in society. And this collaboration is to enhance the prevention, detection and prosecution of fraud and corruption in the health system. I think Advocate Mtivi has spoken on the investigative element. I'll ask Advocate Batoy to speak to prosecution. Thank you, ma'am.
Thank you very much to the Chair. Thank you, Honourable President, Honourable Ministers, Deputy Ministers, colleagues. Firstly, let me say that the National Prosecuting Authority is part of this health sector forum, as you've heard, which is chaired by the SIU. The forum was established by the SAU with a view to foster collaboration with stakeholders in the health sector in order to fight rampant corruption and to enhance, as we've heard, the prevention, detection, and prosecution of corruption in this sector. The role of the National Prosecuting Authority within this forum is to ensure that matters in the health sector, which are referred by the Special Investigation Unit in terms of Section 2.1 of the SIU Act, are prioritized and receive the necessary attention in line with a memorandum of understanding which was entered into between the NPA and the SIU in 2017, but which is currently under review. But what I can say is that in as much as collaboration between many stakeholders was, to put it diplomatically, not optimal in the recent past, I'm very pleased to say that with the SIU and many of the other colleagues that are here, we have certainly enhanced collaboration, which actually gives me the hope that with these kinds of initiatives have the opportunity to succeed. It must be borne in mind that most of these matters, if not all, are investigated by the DPCI and the Hawks, and we work together with them. And I want to mention just a few matters in this sector. So firstly, dealing with the Department of Health in KZN and in Northern Cape, we have the Intaka matter, which involved the supply of oxygen to hospitals in KZN and Northern Cape. These matters are presently on the court roll. In KZN, the acquisition of oncology machines at Addington Hospital, investigations have been finalized and the matter is with the prosecutor for decision. In Pietermaritzburg, the construction of a forensic mortuary, investigations have been finalized and there the matter is also with the prosecutor for decision. The Department of Health in Limpopo, there's a matter involving procurement fraud which is presently on the court roll. In the Northwest, acquisition of X-ray machines and equipment at the Moses Kotane and Joe Maralong hospitals, which involved the revitalization program by National Treasury. We are pleased that investigations in this matter are at an advanced stage. Also in the Northwest, involving the acquisition of offices, investigations are also in an advanced stage. And the Northwest, again, looking at construction of hospitals at Brits and Rustenburg. This is also part of the revitalization program by National Treasury, which are also at an advanced stage. The Mediosa investigations, which have several legs. In one of the legs, investigations have been finalized, and the matter is with a prosecution for the finalization of a charge sheet. In another Mediosa leg, the investigations have advanced. The Department of Health, Gauteng, the 3P investigations have been finalized, and the prosecutor is finalizing a charge sheet in that matter. Department of Health, Northern Cape, construction of the Kimberley Mental Hospital. The matter is currently under investigation. And also in Kimberley, what is referred to as Project Chow, procurement floor, the matter is currently on the court roll. And in the Department of Health in the Free State, there are matters under investigation, some of them quite advanced with regard to various procurement fraud issues. I must say, Mr. President, taking advantage of your presence here, that one of the biggest challenges to dealing with corruption, not only in this sector, but broadly in the criminal justice sector, is the capacitation issues. I'm pleased to announce that the National Prosecuting Authority has received an increase in its budget during the AE&E process, and thank you very much for that. We are certainly going to focus on, in fact, we made the case that we require more prosecutors to deal specifically in our specialized commercial crimes unit, which will be handling all of these cases and other cases dealing with corruption and other serious economic crimes, and also asset forfeiture. But I want to urge that the Hawks still have a very, very, very big capacity problem, Mr. President. And that is where all of the investigations in these matters are sitting. And this is only the health sector. And I'm going to urge on behalf of my colleagues in the Hawks that something urgently be done to capacitate the Hawks. You cannot have one or two investigators on big investigations, and not only the cases, they will be sitting with a whole lot of other dockets as well. And it just doesn't allow for efficient investigation of these matters. So I really urge that the issue of capacity in the Hawks be looked at. The ACTT structure, the Anti-Corruption Task Team, which has been mentioned by my colleague, Advocate Mutibi, I'm pleased to say that there are plans in place to ensure that it does operate more effectively. In the recent past, there have been challenges there, we all know. And so I'm very, very much enthusiastic and confident that the various mechanisms that we have to ensure collaboration, because it's the only way we can try to be effective, are becoming more efficient, and that you will be able to see progress with regard to the investigations and prosecutions of these matters. Thank you very much.
Thank you, Advocate Batoy. Mr. President, I think you will note that, seated around the room is a clear demonstration of what you have always been calling for. The fact that we must break down silos in government, there must be joint planning, there must be collaboration. Some of you may wonder why Minister Mapisa Ngakula is sitting here. She's the chair of the JCPS cluster, which is the security cluster. We're dealing with social issues, but this breaking down of silos in government means exactly that. That while we are, what did the DM say? Good health and good sense. This way of working is really to ensure that we exhibit good sense in the work that we do. But one person who's been exhibiting a lot of good sense since he came into this portfolio is the Minister of Health, Dr. Zweli Mkhize. We're extremely proud of the work that he has been doing, working together with the NHI War Room in the presidency. The NHI bill is now before Parliament. This is obviously one of the building blocks towards a universal healthcare system for all in South Africa. I'd like to invite Minister Mkhize onto the floor, and once he has completed his remarks, he would invite the President. Thank you, sir.
Thank you very much, Program Director. His Excellency President Ramaphosa, the Minister for Defense, Minister Mapisa Ngakula, Deputy Minister John Jeffries, the MECs present here, the Chairperson of the Portfolio Committee, Dr. Dlomo, the National Director of Public Prosecution, Advocate Batoy, the Director for Special Investigation Unit, and the members of the civil society who are present with us, the DGs and other senior officials from government, leadership from the HPCSA and other regulatory bodies, Council for Medical Scheme, SAPRA, National Laboratory Services, and others who are here with us from the health fraternity. Mr. President, we want to say thank you for your leadership. This meeting here is convened at your instance, but it's also a follow-up of the leadership that you've provided in the convening of the Presidential Health Summit, wherein a whole multi-stakeholder compact was drafted, where we get support to deal with how to reform, how to transform, how to correct the weaknesses in the health sector, both public and private. And we want to say that we have appreciated the support, the leadership, the guidance from the President's office directly in the signing of the social compact, which was done recently. And this has actually committed the department and government to participate and work together with the various stakeholders. And I'm glad to hear that already the civil society is feeling that there is good cooperation at that level. We want to commit to further cooperation in this regard, and we want to continue to work to ensure that there is transparency, there's accountability, and that there's good cooperation from government with the various players that, excuse me, that are part of the social compact. It's not, President, that it's us just indicating our appreciation to the leadership. I'd like to also take this opportunity to congratulate Mr. President on the Universal Health Coverage Leadership Award, which we accepted on your behalf in New York at the high-level conference and award dinner hosted by His Excellency Dr. Jakaya Mrisho Kikwete, the former president of Tanzania, who leads the One by One on Target 2030 campaign in partnership with the African Union Commission, as well as the Access Challenge, working together with the WHO. This One by One Target 2030 campaign is a flagship platform designed to help drive the collaborative commitment of 55 African governments to the meaningful progress of universal health coverage. This vote of confidence in our leadership from peers gives us a lot of courage, and it does attest to the leadership that, Mr. President, we have provided. Not only was that the case, but we also found ourselves receiving quite a lot of special mention, in particular the President on the high-level meeting by the elders who were here, who were very, very supportive of the initiative that the President has taken with regard to the issue of universal health coverage. It was also made very clear that the elders have gone around to encourage leaders, because in our case, they've actually said South Africa must succeed, otherwise that might not be good for the continent. And so we believe that the role and the leadership that the President has provided is actually helpful and is being observed by many players outside the country as well. So the launch of the Health Sector Anti-Corruption Forum could not be more timely. For a country that is held in such high esteem, we can't afford to tolerate anything that could actually mar our reputation. Today's launch comes at the back of the Health Market Inquiry Report, which was launched yesterday, and the Competition Commission published this alarming volume of health market irregularities, amongst which it identified an environment where there's little recourse for corrupt activity and failure of accountability at many levels. I think Advocate Mtibi has mentioned a number of the issues. It talks about some of the potential collusion and the helplessness of consumers in the face of rising costs, which could have been prevented. It talks about over-concentration in a number of areas, and the tendencies that tend to drive the health costs up. And the advocate was talking about over-utilization, over-servicing, and this is a big issue that we are dealing with in the health sector, that we should not incur unnecessary costs because, it has got an incentive that it drives, profit margins on some of the players. So in our engagements on the national health insurance, and of course the RWAPs, I saw the MECs were looking around. So President, this is another issue. Government was trying to retain its own staff and therefore gave permission for them to be allowed to do private work. And in the process, they are more in private than in public. And this becomes a real problem that we need to actually act upon. We've also got a situation where you've got more doctors, but they are not as available as the numbers suggest. And this is another area where we need a lot of support, both from the investigation as well as prosecution, to be able to ensure consequence management. The rest of the other issues we can only endorse, which the Deputy Minister John Jeffries had raised about a whole lot of issues around the procurement irregularities, the collusions, and so on, cover quoting, and various other challenges that we face. In our ongoing engagements on the national health insurance with various sectors of society, you can pick up the skepticism of the public based on the experiences on the reports on state capture and corruption, and they ask the question, how will the NHI fund be protected from corruption? And we're very pleased, therefore, today that we want to be able to say that the first steps have been taken by the President to ensure that there is a way to protect this very special entity from any form of corruption. And so the Anti-Corruption Forum captures the theme of NHI and the prevailing theme that was reiterated on the United Nations General Assembly. That is multi-sectoral collaboration. Department of Health has tried to do whatever it could, but it's very clear that without a platform of this nature, it's going to be difficult to tackle this issue. And so we welcome the platform from that particular problem. We have a number of players in this forum, and we are very pleased to see that we have got not only just with the department, but that the councils for medical schemes are here, and they've given us their own report of the various investigations that they are doing in this regard. And I think if we can collaborate, we'll actually be able to have everything happening in one platform. It will help the issues of they are, of course, working together with the Special Investigation Unit, Directorate for Priority Crime Investigation, Financial Intelligence Center, Health Funders Association, Health Professions Council, and Corruption Watch. We've, I think, a few times been hearing accusations from some of the members reporting suspected cases of irregularities in the Health Professions Council. We need all of those investigated, and we need to be working together, particularly with civil society as well as the National Prosecuting Authority. We are serious, and we believe that we need action-driven approach in fighting corruption, which will now obviously be strengthened. We are not only committed to fighting corruption in the public and private healthcare sector, but we also want to fight the corruption that fuels illegitimate claims. The claims are estimated in 2 billion, and some of them we actually believe are not legitimate, and we think that with closer collaboration we'll be able to deal with this matter. It has been discovered in a few other departments, and so I think with this kind of platform it should be much easier for us to be able to deal with the problems at the level of ensuring that we reduce any forms of malfeasance and loss of funds which are claimed unduly just because of collusion and the fact that some weaknesses in our processes end up encouraging people to do the wrong things, like stealing the records and those kinds of things. So we need to be able to know we can trust on a broad platform that can always assist. I've been very pleased to hear that there are reports about various other investigations in different provinces that are moving on, and as we will be meeting as the National Health Council with all the MECs in the next 2 days. We're going to be tabling this matter to say, let's pull all the cases that have been difficult and outstanding, and then make sure that they're all tabled out there. We will actually make sure that we'll create a form of a record, so we know a register of what investigations are going on in every province, so that we can table that and then make sure that it is available to the whole forum, and that will actually help us to track all of those investigations, as it were. So we want to therefore support the issue that has been raised in the Presidential Health Summit, particularly pillar number 7 of the Health Compact, where it's talking about strengthening governance and leadership to improve oversight, accountability, and health systems performance at all levels. We want to say, President, on behalf of the national departments as well as provincial departments of health, we are committing ourselves fully to this process. We will not only cooperate at a national level, but we'll be cooperating at provincial levels, and I'm very pleased that that happens on a day where most of my colleagues, the provincial MECs, are present here, so there won't be any translation or sending messages. All of us are here because we actually appreciate the call and the leadership that the President has made. Thank you very much, Mr. President. We wish this forum all the success. Thank you. Made a mistake. No, that I must apologize for. I think, colleagues, I think in real sincere appreciation for the leadership that our President has given in the fight against corruption in general, and in championing the fight against corruption in the department or in the health sector. We do want to thank the President, and would like the House to welcome President Cyril Ramaphosa, MC Ramaphosa, to come. I'm getting exposed now. But would like to present our President to deliver the keynote address. Thank you very much, Mr. President.
Let me start off by thanking the Program Director, Ms. Kusela Diko, and also thank the Minister of Health, and also acknowledge the presence of Minister Mapisa Ngakula and Deputy Minister John Jeffrey, who's here with us, and also to thank Dr. Zomo, who is the chair of our Portfolio Committee on Health, for coming all the way from Cape Town to be here. And any premiers who are here, I didn't see any, but MECs, we'd like to thank our MECs who continue to do really unbelievably difficult tasks in the provinces, and also thank Advocate Shamila Batoyi for her very wonderful words, and Advocate Motibi as well. And of course, let me also thank the colleagues who have spoken earlier, and also acknowledge the presence also of the FIC head, the director, Advocate Kanyile, and representatives of various entities, and particularly the Council for Medical Schemes, the Directorate of Priority Crime Investigation, Health Funders Association, the Health Professions Council of South Africa. Yes, of course, even though Ms. Diko said they should not be named, Corruption Watch, Section 27, and a number of other organizations organizations, but also the Board of Healthcare Funders, Health Funders Association, and everyone else who's here. I should say that Minister Mapisa Ngakula is here in two guises. She's here as the head of cluster, but she is also here in a way by remote control, trying to watch over the soldiers who are outside, who are practicing for tomorrow's state visit by President Muhammad Buhari from Nigeria. For a minute I feared that they would soon be exploding all those bombs and 21-gun salute, but we were saved. It is immensely encouraging, I must say, to have amongst us such a broad representation of stakeholders. And for me, this is a most historic occasion. Mr. Dave Lewis spoke quite effusively about it. And Mr. Lewis, it's wonderful to be on the same side as Corruption Watch, and we hope that it will continue to be a trend, that we're able to work together and deal with matters that matter most in the lives of South Africans. There's an MEC, now that we're dealing with corruption in the health sector, an MEC who used to be an MEC in Limpopo, and he once told me that as our new government was evolving, he found that a lot of people, both in the public sector and the private sector, started getting very interested in finding ways of making money, and quite often fraudulently, in the education sector. And he says, as they looked more closely, they found that the education budgets are usually all taken up by the salaries that we pay to teachers, and very little is left to either procurement or infrastructure. And he says they soon abandoned education. They said there is no money there. Then they started focusing on health. And it reminded me of there are some legal people here, of a story of a judge who, in the normal course of doing his work, kept on seeing the same person coming to his court on robbing of banks. And then one day asked him, why do you like robbing banks so much? And this man stood up and he says, my lord, that is where the money is. So he focused on banks because that's where the money is. So the focus is now on health, because that's where the money is. Now, clearly this forum today is quite historic as far as I'm concerned, because together and collectively we are now going to take real definite steps to curb the corruption that prevails in our country in health, in the health sector. In that, the signing of the terms of reference, the terms of agreement of the Health Sector Anti-Corruption Forum is one of the critical steps that we are taking to transform the health care system in South Africa and to rid it of not only the inefficiencies of the past, but also to rid it of corruption. This initiative and the report that was released yesterday, the Health Inquiry Report, are the concrete steps and ways that our country should be taking and will be taking to reduce wastage, to reduce collusion, and to end uncompetitive behavior in the market. As many of us will know, that healthcare is the third largest item of government expenditure. And yet there is a fundamental disconnect between what we are spending on healthcare and the health outcomes that our people are getting. We spend a lot of money and the outcomes that they get are much more contained. And in a number of ways, we rank low in global rankings. If you look at us against the backdrop of how we are positioned in the world on healthcare system efficiency, owing to, among other things, inefficient resource management, poor institutional accountability, ineffective monitoring and evaluation, and also on corruption. In the months leading up to the national elections, I had a great opportunity, as some of us did, to go around the country and talk to many people to understand the everyday challenges that our people face. It pained me, as it should pain every citizen in our country, to hear how this most fundamental of rights, the access to healthcare services, has been impacted by the stench of corruption. Wherever you went, people would be talking about how the health system is not functioning, and as you drilled down deeper, you found that it was as a result of corruption. In some parts of the country, citizens are forced to make payments to get access to medical treatment, either at above the official rate for services that are meant to be free. In other places, our parents and grandparents are being turned away because doctors and nurses are moonlighting elsewhere during working hours. Precisely this system and the practice that, Minister, you were talking about. In other cases, and that is corruption, by the way, as they do this moonlighting and neglect the patients that they should be treating. In other cases, it gets even worse. State property in hospitals and clinics, including things like vehicles, equipment, are stolen. And sometimes they get even clever. They hire them out, and at times they even sell them, they resell them. And this isn't a problem that is only confined to the public sector. We also find that in the private sector, suppliers and service providers are involved in practices, really bad practices, such as false invoicing, collusion, price fixing, especially on medicines. And it is because of problems like these and the lack of accountability that accompanies them that the audit outcomes of our provincial health systems or departments continue to decline. When there is corruption in our healthcare system, when the costs of unauthorized and fruitless and wasteful expenditure balloon, we all suffer. Because corruption is in the health system is not a crime that does not have a victim. When people are corrupt in the healthcare system, the victims are immediately identifiable, and the victims are the poorest people in our country and the most vulnerable in society. Corruption impoverishes people. It also violates their constitutional rights to health, and it also costs lives, because in other instances people just literally die. This initiative emerged, as we all remember, from the Presidential Health Summit in 2018, which was convened to identify the challenges in this sector. One of the key recommendations to improve the quality of the healthcare system was to address the supply management of medicines, of medical products, of equipment and machinery, because that is where the money is. This sector was considered to be vulnerable to corruption because of the large volume of goods and services that are transacted, as I said earlier. These include fraudulent orders, tender irregularities, fiscal dumping through NGOs as well, bribery, overpricing, poor governance, transfer of liabilities to the state, and fraudulent qualifications. Now, the summit identified the serious challenge of corruption at all levels. And that summit was quite historic in itself because it touched on the various challenges that we face in the healthcare sector. And it also looked at the absence of consequent management and the inadequate response from our criminal justice system. And it's wonderful that the SIU and the NPA and other agencies are here, because being part of this whole effort is what is going to make us take really effective steps to curb this. Now, it's also been found that political interference in the tendering system contributes to corruption, and this we must admit, and it is a challenge that we've got to address, and we are already taking steps to address it, that those who hold political power are the ones who always pull the strings and try to direct the system towards corruption. We will deal with this. These problems, in the end, prompted participants at the summit to recommend that an anti-corruption forum be established in the health sector, and we are therefore pleased that we have reached this milestone, that all of us are here and in one room, and that today we are going to sign this agreement. We are here because we share a commitment to ensuring that the substantial resources this country invests in healthcare are used for nothing other than the provision of quality healthcare to all South Africans. That should be our main focus, and it will be our main focus as we continue to take steps to rid our country of state capture, to rid our country of corruption. We will do it step by step, brick by brick, moment by moment, and those who are implicit in doing all this, they will, in the end, find themselves being accountable, and accountable in quite a serious way. This initiative has become all the more critical as we prepare to implement the most far-reaching policy for social transformation this country has seen since 1994, namely the introduction of the National Health Insurance. One of the fundamental principles underpinning the NHI is that the funds spent on health in the public as well as in the private sectors annually should result in better care and outcome for all South Africans. I must tell you, it was a joy to attend the G20 meeting in Japan and to listen to those who have been practicing universal health coverage for many, many years. The Japanese have actually done extremely well. And they held a summit which was led by their Prime Minister, and he was urging most of us in developing economies to move more and more towards universal health coverage. And they said, due to the efforts that they made to introduce national health insurance or coverage, they've been able to improve the quality of life of their citizens, and people in Japan easily live way beyond 95, 100 years, to a point where they now want to increase the working age limit, that they should no longer retire at 60, 65, it should now be 75. And at the same time, reduction of corruption in that sector has gone down quite substantially. Now, we want to get to that stage as well, because it's about spending money more efficiently and effectively. It is about reducing wastage and excess, but it is also about making sure that we reduce and eliminate corruption completely. But the most important derivative or benefit or dividend that we will get out of this is about ensuring that our people live better lives, that they live healthier for longer, that they can be more productive, and that they can emerge from poverty. We cannot achieve these objectives for as long as corruption remains pervasive in the health sector. So the agreement that is being signed today is the product of many months of hard work by all the parties to develop an integrated and coordinated approach to these challenges. And in a number of ways, it draws on the resources and the capabilities of all partners, recognizing that they have separate but complementary powers and mandates. And this is the beauty of the diversity that is also in this room today, because out of this diversity we will be able to build a very solid collaborative effort that is going to deal with the scourge of corruption. Importantly, it also acknowledges that no institution or body is able to undertake this work without the cooperation and assistance from other players within the state and across society. And correctly so, Advocate Patoli, we need to capacitate the various sections of the entities that have to play a role in all this. This agreement makes the important statement that it is only through working together that we can decisively rid our health system of corruption and maladministration. So this forum must respond not only to the challenges of the health sector today, it must also respond to the challenges of a fundamentally transformed health system of the future. As we plan, as I said earlier, to introduce the National Health Insurance, it is critical to adequately prepare to secure the National Health Insurance Fund, even before it starts transacting and when it goes on with its transaction processes. The NHI aims to ensure that the use of health services does not result in financial hardship for the individuals, ordinary people in our country and their families. So the bill that is now before Parliament is intended to prevent undesirable, unethical, unlawful practices in relation to the NHI fund and its users. Therefore, if corruption in the healthcare system is not addressed decisively, it will undermine the government efforts to ensure universal access to quality healthcare. We must ensure that the pool of funds that is earmarked to ensure universal access to quality healthcare is not wiped out through fraud and corruption. And in this regard, this forum will play a critical role. And this is an important part because some quarters within our country who are opposed to the NHI fear that the NHI in the end will descend to the same low levels, may I say stench levels of corruption, and that those who are like that criminal who was before the judge will look at the NHI fund and think that all the money is there and they'll devise all manner of plans to plunder. Now this forum here and the agreement that we are signing today will enable us to have our antennas up to make sure that we do what Advocate Mutibi was saying. We embark on preventative measures to ensure that we do not, even for 1 minute, encourage those with corrupt intentions to even think that the NHI fund is a place where they can go and plunder the money. We will continue to rely on the support and cooperation of health professionals, patients, and the general public to achieve our ideals. And in this regard, we will continue to ask all the institutions that are represented here to work together. And I was particularly pleased to hear how the SIU, which is leading the charge in this, Advocate Mutibi, is already at a higher level than I had thought a civil servant would be, talking about data analytics, predictive modeling, things that I thought can only be heard in the private sector. So I think we are ready, and I'd like to invite all of us to work together so that we just cut out the scourge of corruption in our midst. So that where we see acts of theft, corruption, we should report them and call upon all our people as well. As they see them happening, they should immediately report them. The government has a toll-free hotline that people can use to report anonymously, and they should make use of it. And as we set up this type of structures, we should then be able to ensure that those are taken up more seriously. More importantly, people should never be party to such acts, because when you pay bribes to get treatment, when you offer money in return for securing or keeping a job in a clinic or a hospital, when you buy equipment or medicines you know are stolen, you are adding to the erosion of trust and to the decline of the healthcare services in our country. Worse yet, you will be depriving someone else to access service and could mean life or death for them. Let's all remember that tomorrow it could be your child, it could be your parent, it could even be yourself in that ambulance or that hospital bed. This needs to be a society-wide effort where all of us, as South Africans, are actively involved and appropriately empowered and enabled to clean up our health system. And today we are taking a decisive step where all of us as South Africans should be able to say, with the signing of this agreement, we are empowering not only people who are in the sector, but also people who are linked to the sector, people who are actors in the sector, and all our people to clean up the health system. In conclusion, let me commend all the parties to this agreement, commend the Minister of Health for leading the charge on cleaning up our system, and also all of us who were part of the Presidential Health Summit, but also in the presidency, Professor Shisana here, who is working very closely with the Department of Health to lead the process of ensuring that our NHI is put in place. But let me thank all the NGOs who continue to take steps to keep government on its toes. And I want to encourage you, where government falters, where we falter, where we fall short, you are encouraged to keep us on our toes, because you do that on behalf of the people of our country. And yes, with the media as well, where there are stories of malfeasance and corruption, we should not hold back. We should expose all these things, because in our efforts to clean up South Africa and make sure that we are corruption free, we want transparency, we want accountability, and this agreement is going to enhance that whole process of transparency. And to the criminal justice system entities that are here, go on with your work without any favor, without any prejudice, and without any fear. Let us go ahead and clean up our health system. Thank you very much.
Thank you very much, Mr. President. And I think maybe we must also thank you for your leadership in the fight against corruption. And I know that the President doesn't just talk. He wants people to commit and to commit in writing. So now we're getting to the part of the program where we're going to ask all the stakeholders to come and sign the terms of agreement for the Health Sector Anti-Corruption Forum. This is regarding the mutual collaboration, cooperation, and assistance relating to addressing key vulnerabilities identified in the health sector. We will ask, and I will call them up one by one. We don't want to move you, sir. You don't want to move me. Yeah. The President, the Minister of Health, as well as the Minister of Defense and Military Veterans will witness the signing. We will sign in the following order. I will ask the delegated person from each of the stakeholders to come up, starting with the National Department of Health, the Director General, Director General Matsoso, if she could come up and sign first. The 1st of October. Thank you very much, DG. She will be followed on behalf of the Special Investigative Unit, Advocate Motibi.
All right, you're watching live visuals from the Union buildings. It's the signing of the terms of reference of the Health Sector Anti-Corruption Forum. And as you saw, it's a case of all hands on deck. You've heard from the likes of Corruption Watch, the National Prosecuting Authority, Section 27 among them,
yeah,
the National Department of Department of
now
Health.
The signing was the head of the Special Investigative Unit, Advocate Andy Mutibi.
It's basically, look, it all boils down to preventing corruption, especially ahead of the NHI. It's preventing, it's detecting, it's to prosecute fraud and corruption. That's why you have the various stakeholders there signing this terms of reference, outlining their mutual support and cooperation with regards to this forum.
It's also an interesting time to have this negotiation, as the Competition Commission has just brought out its report in terms of its findings in the private healthcare sector, corruption in that space.
Is represented by General Matagada. Thank you, General.
All right, live visuals from Pretoria, the capital, where you see the signing of the terms of reference, the various stakeholders signing the terms of reference outlining their mutual support and cooperation, I guess outlining and lending, that they will be lending towards the fight against fraud and corruption practices in the healthcare sector. And there's a number of them seated there. And basically, Desiree, what they're saying is, and according to a statement I have in front of me, they say the health sector, public and private, is vulnerable to fraud and corruption because of a large and varied number of transactions of goods and services, fraudulent orders, tender irregularities, something called fiscal dumping by government departments as well. So there's a wide variety of issues.
The NDPP head, Shamila Batohi, also signing, putting her commitment to this agreement. But this is also lays the ground for the ushering in of the national health insurance and ensuring that the health is properly regulated when that comes through.
And she will be key, Shamila Batohi, because that equals action.
It's about prosecution.
Prosecution.
Yeah.
You can identify the fraud, but if there's no prosecution, then it defeats the purpose.
I suppose every stakeholder in the room is quite important. Corruption Watch as well. We saw Mr. Lewis there, who will be the people who are watching and reporting on all the activities, on all the suspicious activities, should any crop up.
There needs to be something on the other end of the equal sign, so to speak. And this is, as you know, it follows the historic signing of the Presidential Health Compact 2018, and this forms part of that compact. All right, we're going to take a quick break.
Absolutely.
We'll get you more news next.
Stay with us.